Hello and welcome back. I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute. The Senior Learning Institute is all about providing free education and resources to older adults and their advocates. This Senior Learning Institute educational moment once again features occupational therapist Jenny Williams. In this fourth of 5 short discussions about occupational therapy, we're going to learn more about how the OT helps, and we're going to look at that through the use of case studies. For instance, a 92-year-old just finished receiving home health care, but finds tasks like cooking and cleaning draining, just completely wipes her out. She still drives. She has some short-term memory issues, like leaving the stove on. Sometimes she burns the food that she makes, but eats it anyway. In addition, reaching items in the kitchen and closets are hard due to arthritis and pain in her back and shoulders. Jenny, what are some of the things that an OT can do to help in this particular situation?
There are so many things OT can do to help in this situation. So I think obviously the first thing that's concerning for me in this case is leaving the stove on. So I don't know how many people know about it because I just learned about it recently, but there are several options of new technology that you can plug into the wall and plug your stove into it, and then it will automatically turn off your stove if it's been on too long. They also have new monitors for your stove that you can set up with your smartphone to alert you if the stove has been left on too long. So that's somewhere where I would start with this client, is helping kind of figure out some solutions. No one wants to eat burned food, and it's scary to think about what might happen. So my first goal would be helping find some solutions for the stove. There's so many things to do in the kitchen, so I would probably spend a lot of time in the kitchen. And I had a patient like her not too long ago where one of our OT visits was we took all of her spices down from the top cabinet. We got rid of all the old ones, all the expired ones, consolidated them, and moved them to a nice, lazy Susan on an easy to reach area. So these may seem like easy solutions, and they are, but sometimes it's just so overwhelming to tackle these projects on your own. Having someone around to help you with them and who kind of knows the tricks of the trade is really helpful.
Right. I mean, another example that comes to mind too is the microwave. I mean, oftentimes the microwave is up high. It could be over the stove and hard to reach. And obviously you put something in the microwave, you're trying to warm it. And next thing if your hands aren't steady or whatever it might be, you're spilling something hot on you. So maybe you get to a situation where, you buy a countertop microwave to do the job so that you don't have to worry about hurting yourself and burning yourself.
I've had patients have to go to the garage to use the old microwave before because they cannot reach the one over the stove. It's, one of the reasons occupational therapists test range of motion during the evaluations. Arthritis likes to set up in the shoulders, and that limits how we do our daily activities.
Yeah. I mean, I can see somebody getting on a step stool or getting on a chair to get into the microwave. It's just a tragedy waiting to happen. So, I think what you had suggested is a really, really good idea. Let's look at another case study as well. This time we have an 85-year-old person who lives at home. He had a fall in his bathroom and is now too scared to get into the shower. He has family who can help, but he doesn't want to bother them and doesn't want to make any big changes in his bathroom. How can you help?
OTs are meant for bathing. It's the basic activity of daily living. And, although it's kind of weird to think about and uncomfortable for some people, I help most of my patients with the shower. So that's the whole shower. I get there, help them get undressed, help them with the shower. And usually what OT does, we're not there to bathe someone. We're not a bath aid. Our goal is to find ways to help it be more independent. So, while the person's showering, if they need help reaching the towel, we're going to help them reach the towel. And then we're going to take that information and say, that wasn't, they couldn't reach the towel. What can we do about that? And maybe we add a suction cup hook to the inside of the shower so they can reach it. So while we're there, we're helping with what the patient needs help with, but we're also looking at what can we do to make this easier so the client doesn't need help with that.
Right. And if the whole goal was to stay home and stay as independent as you possibly can, sometimes you need a little help doing that. not going that route and trying things on your own and having a negative outcome could impact your ability of staying home long term.
And it's the confidence, if you're afraid of falling, studies have shown you're more likely to fall. So I've had clients where they said, I'm just scared to death. And so I just stood there for a couple visits while they showered, didn't do much, but provide some education and some reassurance and make some recommendations, but also helped build their confidence a little bit.
Great.
And so that's something that OT can do too, because lack of confidence is related to fall risk.
I could see that for sure. Here's another one. A very active 73-year-old has short-term memory term issues. Let me start that again. Here's another one. A very active 73-year-old has short-term memory issues. He drives and goes to the gym regularly, but he's starting to need help managing taking his multiple medications. And, he wants to put a plan together. He's got it to the point where he realizes that there's a deficiency. He wants to put a plan together so he can stay at home longer and safer. What can an OT do in this particular situation?
Sure. Well, management of your medications is one of your daily jobs. So that's something that OT definitely can address. The first thing that OTs will do is a medication reconciliation. So I do this with a lot of my patients. Maybe they have 3 medication lists from different doctors. So we will go through that with the client, call all of the doctors, figure out what's what, and get a full comprehensive medication list in place. And that's ultimately the starting point. And unfortunately, no one else is doing this. You go see the cardiologist, you go see your primary care doctor, and all these doctors are adding medicines or changing medicine, and no one's communicating. So that's usually where OT starts with medication, is just getting a list set, a comprehensive list. And then from there, we help with different types of medication management systems. So medication planners work really great for some people. Other people, they don't do so great. Maybe they just need to, I've had patients who would turn over the bottle after they took it so they would know when it was taken. So we trial various options for medication management to find what works for what client. As a lot of people think, set an alarm on your phone. Those things can be helpful, but your ringer gets turned off, or you lose your phone, or you're out to dinner when they go off. So it seems like medication management ought to be a fairly easy thing, but there's so many variables involved in it. So having an OT walk through your whole routine with you can be really helpful. As maybe every morning you get up and you make coffee. So setting your medications there by your coffee. It could be just a matter of how you fit that into your daily routine.
You had mentioned medication as well, and I think one of the ways to avoid having interactions and things along that in regard to different meds that you're taking from different docs is to have all those prescriptions filled in one place, so that your pharmacist can keep an eye on what it is that you're taking. And also along those same lines too, I know from a personal situation that a person had 3 or 4 different doctors, and within a week period of time, they all ordered blood work. Some of them were duplicates, a lot of them were duplicates, but had the patient not advocated for herself, she would have had multiple sticks for much of the same blood work, whereas they could have coordinated things and had one draw and taken all the blood work and shared it between all the physicians. So you really have to advocate for yourself. And if you can't advocate for yourself, have someone who can. Jenny, here's one last one and we'll wrap it up. The daughter of a woman who has Parkinson's disease and lives in a skilled nursing facility wants to bring mom home into her home. She wants to be close to mom, wants to be able to monitor things. But before she moves mom home, she wants to make sure that the house is ready and made safe, or as safe as possible that you can for mom. What can be done in this particular situation?
Sure. So let me just start by saying in this particular situation, this would be something that would need to be private paid. So insurance will pay for occupational therapy for the patient if the patient's present. But since this is something that a family member is requesting, it would be a private pay situation. But what an occupational therapist would do would be a room by room walkthrough. So what is nice about having an occupational therapist in this case is that OTs know what it looks like when someone has Parkinson's. We kind of understand the typical struggles that a Parkinson's patient may have. So we'll be looking at the bathroom, making sure that it's set up okay. For an example, the other day I had a lady with a similar thing wanted to bring their mom home, and she had a staircase to get upstairs. So I was able to recommend someone who does stair lifts, and we talked about various stair lift options. So there are a lot of things we can do to let you know, is this even a possibility? And sometimes it's not. Maybe your staircase is so spiral that a stair lift won't work on that. So basically, we do a walkthrough room by room, make any recommendations with the typical client in mind of what someone with Parkinson's might look like.
That's great. Thank you. Well, that is just a few examples of what an occupational therapist can do for you and your loved one. Jenny, we're going to pause right here, but tell us, if you don't mind, what's the best way for folks to learn more about you and what you do? You have a website and a phone number?
I do. My phone number is area code 314-742-0330. And my website is iots.health.
That's iots.health. And the phone number again is 314-742-0330. I want to thank you again for listening to the Senior Learning Institute Educational Moment. At the Senior Learning Institute, we strive to provide the straightforward and unbiased information you need to make smart decisions the first time. We connect older adults and their advocates to the resources they need, from things like aging in place, selling the home in any condition, estate and financial planning, in-home care, estate sales, clean-out services, you name it, anywhere in the U.S. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute.